Speaker, and I beg to move that leave be given to bring in a bill to require public authorities to have regard to the need to consider physical and mental health impacts in the exercise of their functions and for connected purposes. This bill is designed to bring a health in all policies approach to the making and delivery of all central and local government policies, and it has a simple aim: to improve the physical and mental health of our nation for generations to come. The Roman statesman Cicero said, "The health of the people shall be the supreme law." And down the centuries, when governments have heeded his advice, they have performed great deeds, building great sewers and providing fresh water, cleaning up our food by banning contaminants, clearing slums and giving children safe spaces to play, cleansing our city air, vaccinating our children against killer diseases, banning smoking in public places, bringing health and safety, protecting pedestrians against the dangers of traffic, and introducing seatbelts. And of course, the creation of our National Health Service, delivering physical and mental health care at the point of need, irrespective of the ability to pay. But we cannot rest on our laurels, Mr. Speaker. New challenges arise in each generation. New threats to our health and well-being. New responses are required, and that is what my bill is all about. Honourable members will have heard me speak about the mental health crisis we face in this country. This is not the only health crisis we face as a nation. We face a crisis of social care. We have a system which disproportionately focuses on treating people when they are in a crisis or already sick, rather than keeping our population well. We face an epidemic of loneliness, young as well as old. Tobacco remains a toxic killer. Too many cities and towns are blighted by substance misuse. A generation of children is facing obesity into adulthood. The technological revolution has an impact on our mental health and levels of physical activity. Cancer touches every family in Britain. Increasingly, our NHS is contending with lifestyle-related diseases. And for me, the worst aspect of these major health challenges is the inequality in the ways that they impact on people. This really is a social justice issue. Despite all the advances in our nation's health over the centuries, poor people suffer poorer health and live shorter lives than affluent people. Income is a determinant of health, and what a terrible indictment on our society. According to the Department of Health's latest annual report, the health gap between rich and poor is widening. In 2010, life expectancy for men in England's most deprived areas was 9.1 years less than those in the richest areas. By 2015, the figure had risen to 9.2 years, and the equivalent gap for women also grew from 6.8 to 7.1 years. And poorer people are more likely to spend 20 more years in ill health. They're more likely to suffer from stroke, cancer and heart attacks. Poorer people have less chance of gaining access to a GP or a dentist. We've seen an increase in hospital admissions for malnutrition and a stalling in the improvement in our life expectancy for the first time in 100 years. In modern Britain, your length of life and the number of years you spend healthy depends on your address and income. And these inequalities exist for a range of other factors too. Likelihood to suffer a road traffic accident, likelihood to suffer a house fire, likelihood to be a victim of violent crime, likelihood to suffer mental ill health. Look at the locations of our food banks. Look at the epidemic of knife crime. Look at Grenfell Tower. Inequality is a terrible scar on our society. So what is to be done? My bill aims to place the physical and mental health of the population at the centre of all government activity, beyond the confines of the Department of Health and the responsibility of directors of public health in our local authorities, so that no policy is developed or enacted without due consideration of its impact on health, and where possible, policies are designed to actively improve our well-being. This is not a new approach, and I'd like to highlight the work of the All-Party Parliamentary Group on Health in All Policies and the Chair, my honourable friend, the member for Oldham East and Saddleworth. The World Health Organization adopted a statement in Helsinki in 2013 on this approach, stating that health in all policies is an approach to public policies across sectors that systematically takes into account the health implications of decisions. It seeks synergies and avoids harmful health impacts in order to improve population health and health equity. It improves accountability of policymakers for health impacts at all levels of policy making, and it includes an emphasis on the consequences of public policies on health systems, determinants of health and well-being. Health in all policies has been adopted in Wales through the Wellbeing of Future Generations Wales Act in 2015, designed to minimise any damage and increase any benefit from new policies. Wales joins Tasmania and Quebec and British Columbia in having those statutory health impact assessments. And other countries are striving towards the same goal. Ecuador has its Plan Nacional para el Buen Vivir, the plan of good living. In Finland, the health in all policies approach has been part of governance for years. In Thailand, citizens have the right to request a health impact assessment if they feel that any proposal might be detrimental to their well-being. Health in all policies would mean, for example, ensuring the design of all buildings, estates and urban environments encourages walking, running, cycling, sharing and talking, and deters crime and vandalism. It means designing social security systems, including their assessments, which add, not subtract from people's sense of security, which enhances their physical and mental well-being because they know that the system is on their side. Health in all policies means placing duties on food and drink manufacturers, shops, takeaways, on the ingredients of their goods, the pricing and locations of where they sell it, to discourage alcohol abuse and poor diets. It means delivering services for young people and teenagers, for new parents, for people seeking work or the recently bereaved, so that services match needs. The creation of Sure Start centres was an example of this highly innovative approach. Indeed, given that we know how important the first 1001 days of a child's life is, and how what happens from conception to the age of 2 still determines the life chances and the mental and physical health of an infant through childhood to adulthood, then there is no better example of why we need a health in all policies approach than services for mums, dads and infants. This stretches way beyond childcare provision and health checks. It means looking again at patterns of work, income, benefits, parenting, education, food, housing, transport, air quality, playgrounds and many other areas of policy. I acknowledge that we've seen some helpful steps forward in recent years, for example the introduction of a sugar tax or the banning of smoking in cars with children present, but these are piecemeal and uncoordinated. My bill would represent a step change, and it's not just about saving money for our NHS, although this approach would save resources, and that's particularly important at a time when we know that our NHS and social care is under such pressure. But it's also about what the King's Fund calls a cost-effective use of society's funds that reflects the value that society puts on health and other goals. The health in all policies duty would be placed on all public authorities, which would be further defined in the bill itself to include ministers of the Crown, government departments and local government, as outlined in Schedule 19 of the Equality Act 2010. It would be backed by strong machinery within government, and I think it was a mistake for the then coalition government to scrap the Public Health Cabinet Subcommittee in 2012, which might have served such a useful purpose, bringing together all those departments across government. Its remit was to enable the Secretary of State for Health to lead public health across government and work across those different departments to address those wider determinants of health. For health in all policies to work, it will require a central driver, ranging across those departments and agencies with the full authority of Number 10 to bring people together, to break down the walls of Jericho and to create that real cross-government working. No submission would appear in any red box without a thorough assessment for the impact of the proposal on our nation's physical and mental health. Unless some honourable members feel that this is a licence for the nanny state, let me point to the so-called family test, supported by this government and policed by the Cabinet Subcommittee on Social Justice, which requires all policies to be tested against their impact on family relationships and functioning. This is just one example. Government assess the impact of policies all the time, and surely no impact is so important as the impact on our physical and mental well-being. Mr. Speaker, we are told that Brexit affords us the opportunity to reshape our laws and regulations. No measure could have more positive benefits than the UK adopting a robust, full-throated approach to health in all policies. And I'm grateful to colleagues from all sides of this House for their support, including too many members who I was not allowed to include in the list of sponsors, but very quickly would like to reference the honourable members for Coatbridge, Criston and Bellshill, Stoke-on-Trent North, Ealing Southall, Birmingham, Selly Oak, Halton, Batley and Spen, Stockport, Weaver Vale, Enfield North, Leeds North West, Stoke-on-Trent Central, Warrington North, Stockton South and Bristol East. This bill would provide a platform for tackling the health inequalities that blight our communities, for allowing more people to be fully engaged with maintaining their own health and well-being. It would be as solid a step forward as the restrictions on making and selling cheap gin in the 18th century, building the city sewers and delivering clean water in the 19th century, creating our NHS and Clean Air Acts of the 20th century, or the smoking ban in the 21st century. Health in all policies will be our legacy to future generations, and I commend this bill to the House.
The question is that the honourable member have leave to bring in the bill. As many as other opinions say aye. Aye. To the contrary, no. I think the ayes have it. The ayes have it. Who will prepare and bring in the bill?
Debbie Abrahams, Lisa Cameron, Rosie Cooper, Stella Creasy, George Howarth, Diana Johnson, Norman Lamb, Johnny Mercer, Rachel Reeves, Andrew Selous, Philippa Whitford, and myself.
Luciana Berger. Admirable poise and dignity.
Health Impacts Public Sector Duty Bill.
Second reading what day?
Friday the 26th of October.
Friday the 26th of October. Thank you. Order. We come now to the first of the two Opposition Day debates, and the first is on a motion on school funding, and in a moment I shall call the